Welcome to the new Workgroup Meeting Room Request Program. I'm Ken McCausland, the Chair of the Technical Steering Committee, and today our speaker is Dave Hamill, the HL7 PMO. He's going to talk about how the new programs are going to work. Thank you, Dave.
Thanks,
Good luck.
Ken. So everyone will be receiving an email from Lillian, as they have before in past working group meetings, requesting to submit your room request for the upcoming working group meeting. In that request, in the email, there will be a link, and it will bring you to a page that will require you to log in if you haven't done so. And so today, our first example, will be using Rick Smithies as the co-chair. Once you log into the application, you'll be presented with a screen that indicates what working group meeting you're submitting the room request for. So, for example, what you see here is for the January 2015 working group meeting that's going to be held in San Antonio, Texas on Sunday, January 18th. This request will be sent out around the September 2014 working group meeting in Chicago timeframe. On this screen, you'll see that the due date to fill out the form is by a particular date. It's about a week after the current working group meeting when the request is sent out. You'll also see your list of work groups that you're a co-chair of. Rick is co-chair for clinical statement, so we are going to use that as an example. The first place you'll want to go to once you log in and see your application here is the View Instructions button here. It'll give you a lot of information, especially since everybody's going to be new to this application. So it basically gives you the 5 steps of how to request a room. So to host a new meeting, you'll begin by selecting Schedule a Meeting. Once you're in that process, you're going to select the quarters that you would like to meet. Now, after you've done this once and going forward as a co-chair for your work group, the selections will be pre-populated from your prior working group meeting scheduled meetings. So it'll actually be easier as you continue on as co-chair, especially for those work groups that meet the same days, same quarters, work group meeting after work group meeting. You enter in some information for each of your room requests, which would be the number of guests that are from your work group. You're going to select any joining work group that you would like to invite to the meeting, and there's a notes field to write any description of the meeting and make any notes of any time discrepancies. For example, we know that there are some Q5 meetings that are actually scheduled from 7 to 9 p.m., but on the screen that allows you to choose quarters, it indicates that Q5 is, I believe, from 5:15 to 7, a normal Q5. So anyway, that's how you would identify that you're going to meet from 7 to 9 p.m. Once you have all your information in there, you click Done. And then for anybody who has been invited to be a joining work group, you want to respond to those invitations, and we'll go through that today. So a couple of notes. Again, you may edit your meeting information up until Friday, September 26, 2014. After that date, we're going to lock this system down so you can't make any changes. If you do need to make any changes, you need to email and work with Lillian directly. If your work group is invited to a hosted session, you will be notified. And please respond to the section titled Joining Meetings located at the bottom of the page. This is to clear up and make it easier to have a hosting work group invite other work groups to join them. If you have any conflicting engagements, you'll be notified with a red double booked button, and we'll show you that button later in the training. Click on the button for more information, and once you modify your meeting, the double click button will no longer appear.
And Dave, a quick question.
Yes.
The hosting work group only identifies those people from their own work group that's going to show up. The joining work groups then identify the head count that they think from their work group that will join the hosting work group. Is that correct?
That is correct. So if the hosting work group says they're going to have 5 people there, and the joining work group says, yes, three from our work group will appear, then the report that the system generates for Lillian will reflect that 8 people will be in attendance at that room.
Thank you.
And the last bullet here, just remember, during an annual plenary working group meeting, which typically occurs in September, you will not be able to schedule any meetings during Q1 and Q2 of Monday, as that's our plenary session. And then one last reminder is always to please be sure to upload your meeting minutes from the current work group meeting by a particular deadline. So that's something that Lillian's always provided in her email communications. So now we're going to get into requesting a room just for clinical statements. So Rick would come in here and he would want to schedule a meeting for clinical statement. What is brought up is a calendar with check boxes where he can indicate which day, which quarter he wants to request the room. So as I mentioned here, as you can see, Q5 here typically goes from Q5:15 to 6:15, or we also have an option for Q5 to 6 to 7. That was some feedback we got from the pilot participants that Q5 can be a couple of different times. So if clinical statement wants to meet during Q1 Monday and Q2 Tuesday, they simply do that. They click continue, and then this screen is brought up for them to add additional information. And we're going to just do some simple work here. We're going to enter the number of guests. This is the estimated number of participants from your work group that you're inviting to the meeting. We're not dealing with joining work groups right now. We're just going to have it such that clinical statements is just meeting on their own. And then the notes, write a brief description of the meeting. The work group meeting administrator, as well as any joining co-chairs, will be able to review this information. And please be sure to make any note of time discrepancies and make note of any room equipment requests. Now note, all meeting rooms will contain an LCD projector, a screen, a cart, cord, flip chart, and power strips. And larger meetings will automatically include wireless mics. And note, we are not able to provide Polycom conference phones or other such devices. Once you've entered your information, you click the Done button, and your selections will have been pre-populated from the previous work group meeting going forward. So going forward, if Rick logs in here, his clinical statement request will already be in there. So let's say he's going to have 5 people on Monday from clinical statements, and he's going to have 7 on Tuesday. We said we're not doing any joining work group, and if he needs any special needs are entered here. And you can also always click on the help buttons to find out more information about each of these fields. If you ultimately need to delete one of these entries that you're not going to meet, you can click on the red delete button, and you can actually add quarters if you also need to add, oh, we're going to meet Wednesday at Q3 as well. You can add the quarters here using this button. But if you're done, you get a confirmation here. The quarters have been updated. If you have invited any joining work groups, an invitation has been sent to the representative of those groups. So right now, you're brought up with this information. A little note here says click on resend invite to email an invitation to the proposed joining work groups, or delete to cancel the meeting. So we can also, another button here, we can look at the calendar view. And here, it's quite simple for Rick because he only has one work group he's looking at right now, but it's in a format that it shows Monday's schedule as well as Tuesday's schedule, and all the same information is here. If he decides, no, I don't need Tuesday Q2, he can delete it. Again, you can just simply delete it, or you can delete without that. Deleting it with OK would notify the administrator and co-chairs of the delete. So that's typically what you want to do, because you want to have the system communicate with your co-chairs. Now let's get into the joining work group. So what we're going to do is we're going to say, Clinical Statements wants to host a meeting with orders and observations. So Rick has communicated with orders and observations, and he knows it's going to be Wednesday at Q4. So he clicks on that edit button. He adds quarters. Wednesday at Q4. The 5, let's make it a little different. Let's say he's only going to have 4 of his clinical statement peers at the meeting. He wants to invite orders and observations. He can invite other work groups as well. He can continue ordering. He can invite more than one work group to join. He says clinical statement is asking what will happen here is his quarters will be updated, and OO work groups will receive an email to have them confirm the request to join. You'll see down here, this is the view he sees. Clinical Statements is going to have 4 guests. His notes were copied here. And right now, he has requested OO to join. He has not heard a response from OO. They have not accepted or declined the response. And so right now, there's no guests from OO yet. If he needs to resend that invite because he hears from an OO co-chair, I haven't heard that you've asked us to join, he can simply resend the invite using that button. So what we're going to do next is log in as Ken, because I know he is involved in OO. And so we will log out as Rick, and we'll pretend Ken now needs to go in and do his room requests. So Ken is presented with this screen, a lot of the same information. He can always schedule a meeting on behalf of OO. He has a note here that he has not yet replied to 1 or more invitations, and click here to view your joining meetings. He also has this information here about the joining meetings, where he sees that Clinical Statement has asked OO to join them, and he can reply. Before we get to this down here about the joining meetings, let's do a simple request, and let's say OO meets Q1, Q2, and Q1, Q2 of Monday and Thursday. Well, we'll just, actually for simplicity, let's just do Q1 and Q2. You've seen this before. And we're going to say, for whatever reason, Ken gets distracted and clicks Done. Notice that there's 0 number of guests here. So we need to edit those. And let's say he puts in 1 and 2. The number of guests must be at least 2. So that he needs to, in order to make a room request, you need at least 2 guests. I will let you know this is a bug in the system. I was hoping that error would occur when these number of guests were 0. The bug only exists in Internet Explorer 9, which I use. So if we actually enter our information, we get that confirmation message, and now Ken's screen shows all his hosting OO meetings here with the joining meetings down here. So let's focus on the request from a clinical statement for OO to join. Ken needs to reply. He can either accept or decline the invitation. He can also tell clinical statements, is it just representatives only, or is it going to be the whole work group? So let's say it's going to be the whole work group. He can add any note he wants there, and let's say he clicks done. Notice I've anticipated number of participants is 0. I want the error message to show there must be at least 1 participant in the joining work group. So we know OO is a big group. We're going to say there's 11 participants. We click done. The message has been sent to the clinical statement co-chairs. And so now you can see Ken's screen reflects both the OO meetings as well as the joining meeting that that OO is going to have 11 guests. Now, later on, if for some reason OO decides, nope, we're not going to be part of that clinical statement work group, combined meeting, you can go back and you can certainly decline the offer. So that's how you decline it. But we will actually continue to be accepting it for right now. So when Ken is now presented here, excuse me, his information here, click here to view your joining meeting, simply puts you down to this area here. So Ken's taking care of all of his work group meeting room requests. Let's go back and see what this looks like to Rick under clinical statements. So you can see now that Rick has received something from Ken McCaslin. He's accepted the invite. They're going to have 11 here, along with their other 4 for 15 total. And Ken had said the entire team will join us. If Rick needs to email Ken, he can certainly press that button there. Because we're in test, we're not sending out any emails. So one more item to show you. Let's say clinical statements is going to want to do another join meeting on Friday Q1. So we have this click here to see who will notify when you click done. So we have this help here. And it shows the OO co-chairs because it shows who your joining work group is. So on Friday, if we say we're going to have 7 people on Friday and we're going to invite child health, you'll see that child health was also added to that list of who's going to be notified. So there's a way you can make sure that the person you want notified is going to be notified. This is just a list of the co-chairs. I just wanted to make sure everybody knew that feature was out there. And I'm going to delete that. And what we'll do next is I will want to show you the double booking icon. We're going to actually log into my account because through my testing I have had a lot of double bookings.
While you're doing that, Dave, so all co-chairs are going to get the email when they've been asked to join, and all co-chairs will get a message when a particular co-chair has inputted the meeting room request.
Yes. Yep, all co-chairs are communicated it. So even though Rick was the one that did the room request, all of the OO co-chairs received that request.
Very good.
So you'll see here, the reason I logged into my account last is because I've been doing so much testing that I'm double booked everywhere. And so you will be presented with this red icon here indicating that it's double booked. And it indicates I am double booked with electronic services and tools on Sunday January 18th, Q1. We had a test work group here called contract work. So this is saying contract work Q1 is double booked with electronic services and tools. And because I have access to both, you'll see in my joining work group meeting down here that sure enough, electronic services and tools and FUR, we're going to be meeting here, or actually it's this one here. So anyway, that is how you're communicated that you have a double booking. Also, with all my testing, the calendar view here is a little bit more robust, where it shows what my schedule is, with whom, who the join group is, etc. So I wanted to show my calendar view. Now, we have not generated any emails, but if we were to generate emails, I want to show the group how they would appear. So we've actually, in test, been just storing all the emails within a database. What you'll see here, today is August 20th, about 11:30 or so. You can see all of these emails have been generated from our pilot effort of this work group meeting room request application. So you'll see here that clinical statements, so the subject, so everybody will be receiving these things, both clinical statements and then the joining work group OO in that case. So you'll get one with a subject that says, it's preparations for clinical statement. It shows the chairs. It shows the quarters that have been requested, the number of guests, all the information that you provided. And then it will include a link to resend that email if you need to. We'll look at another one. Here's where we deleted the quarter, if you recall. That would generate an email. I think we had added yet another quarter, and we're asking OO to join us here. This is the meeting request from clinical statement to OO. Okay. And I know this is a lot of information to go through right now, but once we're in live production, it'll all make sense to you because of your personal work groups you're associated with and the joining work groups you would want to be meeting with. So that shows all of the emails that could be generated. The one last thing I wanted to show is that what if you're not a co-chair and you try to log into the system? You will be presented with an error message like this. So it just indicates that you must be a co-chair to log in and use that application. And so, Ken, that pretty much shows all of the functionality that the application can provide. Like I said, I think this first time it's going to be used, it's the most work any co-chair has to do because it's not saved for them. The following work group meeting will make it a lot easier because people will say, yep, I'm still meeting the same quarters and days that we have been forever, and I see it's already pre-populated, so most all the work is already done for me. So, Ken, I'm not sure if you have additional questions. If you do,
I don't. I want to thank you for giving us a great tutorial on how to schedule rooms for the next work group meeting. And as I believe that you're always available to answer questions, and during the work group meetings, you're always at the HL7 desk available, and they certainly can reach out to any of the ES co-chairs if they need some additional help as well. So that would be, I'm trying to run through the names in my head, Lorraine Constable, Jeff Brown, Nat Wong, Andy Stishin. Am I missing any of the co-chairs?
I think that summarized most of them. There's the tooling, because ES and tooling has combined, the tooling co-chairs may not be as familiar with this application as the ES co-chairs have been because the ES team is the one that started this project. And we, of course, have the 3 training sessions in Chicago on Thursday that we're going to have. So we'll be releasing this webinar after those training sessions to help people as well. So I think that's all we have for today. All right. Thanks, Cam.
Bye.